And thank you so much for joining us once again. This afternoon, we have the Director General of Ghana Health Service and his team to give us an update on public health outbreaks. As you are aware, this afternoon we had a scare. When we saw news items, I believe a lot of you have been reaching out to all of us that you saw a story which mentioned a confirmed case of Ebola here in Ghana. We are honored to have the Director General of Ghana Health Service himself to update us on such matters, whether there is any merit in that story or whether it is false. This is an opportunity for us to know what's happening in relation to that story. There are other updates that the Director General of Ghana Health Service will also give us in relation to monkeypox and other issues related to public health. So as we proceed, I would like to acknowledge some dignitaries who have joined us this afternoon. With us is the Head of Disease Surveillance at the Ghana Health Services, Dr. Dennis Laye. We also have Head Expanded Program on Immunization, EPI, Dr. Kwame Amponsa Achiano. We also have the Director in charge of Public Health, Dr. Franklin Asiedu-Bequin. We also have the Director Health Promotion, Dr. Abuaje Da Costa, and of course, the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaje. So I will now leave the platform and invite Dr. Kuma Abuaje to give us a substantive presentation, and then we'll come back to you for your questions.
Thank you. Good afternoon, all, and thank you, Honorable Deputy Minister, colleague directors, journalists here. We are here once again. I think the last time we were here was about 2 weeks ago to give you updates on the COVID situation. I will speak about the public health emergency situations in Ghana, COVID-19 updates, an update on COVID-19 vaccination, updates on monkeypox and the outlook as to where we are and what we need to do. But as the Deputy Minister mentioned, this afternoon we've had some news that I want to use the opportunity to explain what has happened. We don't have any Ebola case, but as a service, we always do simulations. We don't just wait for the thing to happen. We do simulations to say, should I have Ebola today? Is my system ready? And so that was an exercise that was being carried out in Tamale. That should there be Ebola outbreak, would the system be ready? Would the labs be ready? Would all the surveillance people be ready? Then that's what I think somebody misconstrued that to be a real outbreak. So it's one of the simulation exercises we routinely do for such cases. Should there happen, whether it is Lassa fever, yellow fever, anything, we do periodic assessment to see our preparedness should this happen. So that's what I want to put out there. We also put on our social media feed to explain that the situation that we are in. On the general outlook of public health issues, we have an increasing number of reported cases of COVID-19 across the country. We have mainly workplace and school outbreaks. Some schools have closed down temporarily to control the spread. Other companies have also taken a little break to make sure that they are able to contain the spread. The Omicron sublineage BA4 and BA5 are driving the current increase in cases. We have reported 4 new deaths from COVID-19. The number of monkeypox cases has gone up, but the last one we picked was about a week ago, and then the vaccination drive is also picking up, which we'll share with you. Total number of confirmed cases for COVID-19 so far stands at 164,843. We've done nearly 2.46 million tests. About 161,000 of the 164,000 plus have recovered, with a total death of 100,448, which means that in the last few days we reported additional 4 deaths since the last time we had deaths. The active cases is now 1,417, and currently we are having severe cases and 14 severe cases and 3 active cases for COVID. Then the next slide just is the usual slide. You can see the 4 waves. Now we have a little increase that is going up, and we need to be very careful before it becomes a full-blown wave. So if you look at the next slide, it actually depicts the number of cases that were happening in April and May till now. And so you can see that we have the cases, and then we also have the contacts tracing that is being done to catch up the cases. So you can see that there is an upward, we have a little drop, but it's still on the average, there's an upward surge slowly as it goes, the days come by. If you look at Greater Accra, which is the main driver of the new cases, you can see that between March and early April, it was quite silent, but it has been since May been seeing a rise. So if you look at the graph, you can see there is gone up. There seems to be a little plateauing, but that is maybe a temporary one. So we shouldn't take that one serious, but we want to ensure that we bring it down. So you can see that the active case is also going up across the country. What is interesting is that if you look at the active cases by age, we have the usual 30, 25 to 59 as the bulk of the cases. But you can see now for the first time we are having some increases in the under 15. That's 10 to 14. 0 to 5 used to be less than 1%, but now you can see the numbers are going up as far as the cases are concerned, of the active cases. So that tells you that we are also having some challenges with the kids, and that's the group that's unvaccinated, and that's why we're having some outbreaks in schools. It still is a generalized outbreak. We still have regions that do not have cases. But if you look at the top 20 districts that has active cases, you can see that Ayawaso, Greater Accra, accounts for the largest number. About 10 out of the 20 are all districts in Greater Accra. We have some in Ashanti, it's Kumasi. We have Central, Ahafo, Bono East, and Eastern region. So half of all the cases, and if you rank them in terms of the highest, you can see that Greater Accra still tops, apart from New Jabin, that just pops up in the middle. Most of them are all Greater Accra districts. I think it goes on. And the communities and districts with about 10 or more also comes up in the next slide. If you look at the active cases by region, it's nothing, it hasn't changed much. It's the same large number of Greater Accra is being affected. Ashanti, Eastern, Bono East, Western, and Central. Then mainly the middle and southern belt is where we have majority of the cases, and with the lowest. OT has 1 active case. Savannah has no active case. Upper West has 5. Northeast 4. Upper West 4. Bono 20. Ahafo has 8. And Western North has about 10 active cases. So if you rank the regions into low, medium, and high, the region with low caseload is Savannah, Oti, Northern, Northeast, Upper East, Upper West, Ahafo, and Western. That's about 9 of the regions. We have medium, then to 50 cases, Western, Volta, Central Region, Bono East, Ashanti, and Eastern. And the highest, those in the red group, is Greater Accra. So Greater Accra always stands out, and so a lot of the drive of the spread is also coming from Greater Accra. So what is happening in Greater Accra? There's been a gradual increase in the number of COVID-19 cases across the Greater Accra region over the last 1 month. We have an average daily cases has increased from 1.3 in April to 13 cases in May and to 133.1 cases per day in June. So you can see 1.3, 13, and then 133. So in June, the number of cases being reported in Greater Accra is fine. It's very, very high. Of course, there's a lot of testing now. There's a lot of contact tracing to ensure that all cases are tested and isolated. And 20.8% of the cases in Accra are children between 0 and 15. And so last time we came, it was 18%. It's edged up to 20%. And so something has to be done as far as the protection of children are concerned, because they are also not vaccinated to give them the protection they need. So what is driving the surge? Of course, is the new variant, BA.4 and BA.5, which is part of the Omicron sublineage. Adherence to the protocol, as we are all aware, is very low. Now, even in this room, I can count the number of people who are not wearing masks. I just took mine off, so don't count me. But we can see that we still have, previously, we will not find anybody in this room not wearing masks. But now I can pick about 5, 6 people who are not wearing masks. And so that the hand washing, the social distancing, these are all extremely relevant that we stick to it. All the system that we put in place in workplaces to make sure doors are open, ventilation is improved, people are washing their hands. Where necessary, doors should be opened. Mass gathering to eat can be curtailed. All these things are still very relevant, especially in Accra. But of course, if you don't take these measures anywhere, you can move from 8 cases, active cases, to 1,000 in a very short time. The booster uptake is also now. We have booster doses for every Ghanaian who is eligible for vaccination, but the number of people who are taking the booster is low, and we are urging that people should take the booster, because after a few months of the vaccination, the antibodies come down, and so taking the booster is very, very useful and very helpful. We are also in a seasonal flu season, so this is a time where transmission is faster, and so also it's part of the reason why we are. So the most important thing is the adherence to the protocol. We can't change the seasonal flu season. The lineage, the variant of the Omicron is around, and so we need to take care to make sure that we really apply the protocols as much as possible. So far, the number of students, still a lot of underreporting. We know that there are about 13 schools that have reported outbreaks. But we also know that there's a lot more than 13 who have not reported. We have had 245 cases among these 13 schools. 134 have recovered. Around 111 are still active. They are still waiting to recover. The good thing is that we've not had any deaths among this group. So if you look at the next slide, these are the spatial distribution of the schools. They are all around the same Accra Metro and its environs. And so you can see that we need to really be careful in this zone. For the active cases in Greater Accra, 749 of them are mild or asymptomatic. They don't have any symptoms. They are just positive and they are very mild symptoms. 19 of them are moderate. Severe 13 and critical is 2. Because of the vaccine, Greater Accra also has probably one of the largest population vaccinated. You can see that we are not having the usual distribution of having more severe and critical cases. But it's also possible that also this variant is not very severe. It doesn't cause severe disease. And if you look at the age distribution in Greater Accra, we are focusing on Greater Accra because it is the main driver for the infections that spread to the other parts of the country. You can see that we used to have less than 2% for 0 to 5 years. We are now doing about nearly 5%, 4.7. 6 to 10 is 5.9%. 11 to 15 is 6.2%. That comes to nearly 20% of those who are infected. But previously, we were not getting that group infected. And of course, the same goes as the usual. So what have we done so far to reduce the control, bring some public health measures to ensure that we bring this outbreak under control? We have enhanced education on adherence to wearing of the face mask, especially in enclosed spaces such as classrooms and workplace settings. And so we also are aligned to the recommendations from GMA and GRMA as far as these are concerned. We also got in GES to issue a circular that says that all students should wear masks in their classrooms, and all the measures that were put in place to ensure there's no mass gathering in schools have been done. We have also sent additional staff to the schools to ensure that there's good surveillance and we are able to quickly respond when there's a case so that we can contain the spread. We are also intensifying the vaccination of all the eligible population and administration of a booster doses for those due. We have also made apply to our NITAC to ensure whether we can give vaccines to those between 10 and 14 so that we can also increase the number of people who take vaccines. We are doing very active school surveillance because that's becoming a major problem. It's not only Ghana, there are many places where the youth is becoming the drive, but they are the least vaccinated and they are also the most active. So we can enhance our surveillance in schools and for the youth to ensure that we are able to identify them early and isolate. And we continue our safe education on ventilation practices, indoor spaces such as schools and workplaces should ensure that these measures are taken. We have reported 4 deaths, as I mentioned earlier. We have a 43-year-old female, a 63-year-old with a comorbidity, 18-year-old male with who also had pneumonia on top of whatever he got, and then the 83-year-old. So these are the deaths that we have had. And this is just and these are all, I think 2 are in Accra and 2 are in Eastern region. That's where we have the cases. So far, we have received, so let me talk about the vaccination part of the response. So far, we have received 32 million doses of vaccines, nearly 33 million since we started doing vaccination. We have distributed 25.4 million doses to the regions, and we still have stocks in the regions. And the national stock, we have 7.4 million doses of the various types of vaccine available for redistribution as the stocks in the region run out. So far, I think the last time we were here, we had done about 15.3 million doses. We are now doing about 16.75 million doses. So the drive is picking up. The campaign has worked. About 52.2% have received at least a dose, and then that accounts for about 32.9 million percent of the total population. We have had about 7.1 million, which is about 36%, who are fully vaccinated, and then 22% fully vaccinated if you project it to the total population. So the vaccination coverage is increasing, but we wish it was faster so that as the virus decides to stay with us, we also decide to be all protected and not have it spread. Incidentally, when you look at the vaccines, you can also see that where the population, the larger population is vaccinated, is the region that also has the least cases. Of course, maybe the southern part has a more populous situation. So when you come to Greater Accra, is not doing well, not doing too badly. They are green, but Eastern, Ashanti, Western North, Ahafo are still not doing too well in terms of the population that are fully vaccinated. The last time we came here, I mentioned that we have about 90 districts that are doing less than 25% of the population vaccinated. Now the number has dropped to 73. Some districts have had their numbers pop up to. So we have 73. We are hoping that by the time we come here, it's 0. So that at least every district have had at least a certain proportion of the population vaccinated. So the number of yellows have reduced, and we continue working hard to ensure that we don't have any yellow and we have more deep greens across the country. We still, for the school vaccination, is still ongoing. We've done about 379,834 cases, and Central, Eastern, and Greater Accra seem to be doing much better. And then Ashanti has probably the largest population of school students in that population, but we still have only 20%. So we are going to make sure that in this campaign that we are doing, we also focus on them to make sure the numbers also go up. So if you look at the total number of vaccination per month, we got as much as 5.9. In February, it dropped to about 0.83 in May, but in June, we are midway, or a bit midway. We are reporting midway, and we are doing about 1.26. So we are hoping that by the end of June, we would have peaked a bit more above where we were. Maybe we come to the March figures, and then we can also continue to increase the number of cases that we are vaccinating. As we used to have a challenge of vaccines, now vaccine availability is not the problem. We're actually having to manage the cold chain, having to manage the supply chain to ensure that we don't have more vaccines in the system. So we are saying wait and deliver. So we are now scheduling the delivery because we have enough vaccines for everybody. We still have a significant challenge as far as hesitancy is concerned, especially in the areas where the cases have not been high, where people feel that they feel they don't see themselves at risk, and so convincing them to take the vaccine is a challenge. But that is where, when you have a new surge, those are the places where you are going to have more people getting sick because they are not protected. We have misinformation as one of the key drivers for the hesitancy. Some of the stories you hear are just ridiculous, but we still get people to believe them. Fear of serious side effects, and you know we are all in this country. We have given 16.4 million people, and we know what has happened. Concerns on efficacy and safety. We will continue educating people that the vaccine protects you from getting infected. It's not 100%, but it also protects you from getting sick and getting severely sick. And so there's still a lot of gain in having been vaccinated. Of course, there's this low-risk perception I talked about. and sometimes it's also political and religious beliefs that is fueling this hesitancy. And we need to continue to work and engage community members, politicians, everybody to ensure that these things are removed so that we can all get protected. So the outlook on vaccination is that we continue to allocate resources for social mobilization efforts. We have done the first round for 2nd to 6th February. We've had another round from 21st to 25th of April. We are currently, we just completed the 3rd round, which is still ongoing anyway. And then we are going to have a 4th round between 24th and 28th of June 2022, and to ensure that we are able to cover more grounds. Okay, so that's it for COVID. Monkeypox, as was reported globally, and then also what we found in Ghana, we've had about 72 suspected cases so far, and we have investigated in Ghana. Among these, 18 so far has tested positive, and the last case was on the 14th of June. That's when the lab report came out. So I want to say that maybe the last case was ever found was about a week ago. So that's where we are as far as monkeypox is concerned. The age ranges between 9 months and 41 years, and mainly we have found them in Greater Accra, Ashanti, Bono, and Eastern, and case fatality rate is 0. Nobody has died from monkeypox yet. But I want to also add that let's not make it look like monkeypox has just popped up in Ghana. You can't have a disease all the countries on your left and all the countries on your right, and then the virus will jump over you. But now that we are actively searching, we are finding them. But it's also good that I find them and stop the spread. So the cases are in the next slide, where you can see them in the Greater Accra, Ayawaso, etc. This is where we found the cases in Ghana. So what's our outlook? We are dealing with a multiple public health emergency currently, as COVID-19 and monkeypox. They are experiencing an increasing number of cases of COVID-19 across the country and virtually all regions. It started from Greater Accra now, and we are picking cases in the region, so there's a need to quickly stamp our authority and make sure we are able to keep it down. The COVID protocol adherence is still low, and we need to work on them. Vaccine uptake has improved, but it's not the way we want it. We want to make it faster because they are available. And there's an increased risk for a major wave of COVID-19 vaccines if current trends continues, and that is if we also don't change our attitude to the protocols. So mask wearing is recommended in all enclosed spaces, and wherever, like I said last week, you feel threatened in enclosed places, too many people around you, please wear your mask. And if you all wear a mask, we really keep vaccine the COVID away. Thank you very much, Honorable Minister.
Thank you so much, DG, for the presentation. That was so brilliant. And please, you heard from the horse's own mouth. We have no reported case of Ebola in Ghana. Please spread the word. Also, the DG talked about the increase in COVID-19 cases in the country. And it's so insightful to note that we have as much as 32,836,648 doses in the country. So please, to protect yourself, your family, your community, get vaccinated. Because if you don't get vaccinated and you pick the virus, as my friends will say, what can come, can come. Because it is proven that getting vaccinated is almost the surest way to make sure you don't become severely ill or hospitalized. On that note, ladies and gentlemen, we will take your questions and go to DG for his response. Okay, so we'll pick the first question. Okay. And then I can see Justin at the back. Okay, so we pick Cyrus.
Good afternoon. My name is Agnes. I report for Chronicle. Please, I would like to find out if you wouldn't want to suggest that we go back to mandatory wearing of nose mask, because I think a lot of people are not wearing it because of what the president said. So if we can go back to it, and then also with the washing of hands and all the other protocols, I think it will really help. So if you can consider that. Thank you.
Thank you for the question. We have 2 hands at the back.
Please, my name is Sarah Apenkra, I report for TV3. First, I would like to find out from DG, with the number of cases being recorded between the 0 to 15 years, how soon are we considering their vaccination? Like you mentioned, it's in the process. I also want to find out the schools that were closed down due to the COVID outbreak, if we could get specific number. And the vaccines for monkeypox, the last time you said it was too early to talk about vaccines because the cases were, now that the cases are rising, would we be considering getting the monkeypox vaccines into the country? Thank you.
Okay, thank you, Sarah. Let's take the next question. Okay. But before then, I heard DG mention that so far 13 schools have reported cases, but they also believe that they may be underreporting. So that's... Okay. Not the number of schools with reported cases, but those who have closed down. Okay, well noted.
Okay, Honorable Mbasho, good afternoon.
Good afternoon.
Okay, from Opoku, Free Kingdom FM. Pastor, my question here, it boils down to the lady first question. Dr. Emma presentation on my ETS said, I share the number of amount for vaccinated, like the whole population. Less than 40% of the population are vaccinated. See, again, they inform me on my decision to advise president say a bit easy restrictions, knowing very well say the population in vaccinated in year, and so knowing very well say after even being vaccinated, we still stand a chance to having the virus again. Then they inform me on decision to advise the president on that, and I say I'm more promote to even advise the president on that decision, and that's it.
Okay, thank you for the question. We can take 2 more questions if I see any hands. Okay, so we'll take one from the left wing.
So I'm Doreen Andor from the Daily Graphic. I would want you to go over the criteria for taking the booster doses. It looks like a few people are confused as to whether it's 3 months or 6 months. So what is the criteria? And of which somebody can take a booster dose. Thank you.
Thank you for the question. Please, if you have any question, this is the best time to ask. Okay, I take that to be the last. So we'll go to DG for his responses.
Thank you very much, Honorable Minister. Mandatory wearing of face mask. I believe that the education is enough and that we should stick on that. People see the value in the wearing the mask, and I think it's a more sustainable approach than saying that we are going to make a law that will. But for now, we don't think that we have reached a stage where we need to. But we believe that with the upsurge of cases, people are on their own without any prompting are wearing their masks. So I think we're going to more of a behavior change approach so that it becomes sustainable that if you go to Asia, everybody is wearing masks. There's no law that you should wear a mask, but they have seen the value in wearing the mask. And so I think we want to move on more with a sustainable approach to that. Sarah wants to know the total number of schools. I know about 2. It is not a recommendation that schools should close down. But the school decided that it's getting out of hand. Let's stop for a week or 2 to see that it's contained and come back. But that's not a recommendation that we do. I know of school 2, but most of them don't report these outbreaks. Or they don't even give you the reason why they still, but we know. So that's what it is. See, monkeypox is endemic. And we haven't reached even the surge where you can even do some reactive vaccination. And so for the number of cases, I don't think there's a need. We have not reached any need to look for vaccines for that. And there are criteria even before you can qualify to get those vaccines. So they are in limited supply, and if it is not, there are countries with 1,000 cases, they are not vaccinating. So we really have not reached a point where we need to get the vaccine for the school. But you also talked about, I think that was how the children to be vaccinated. For the children, we have a system. We have the National Immunization Technical Advisory Group who look at all the variables of safety, everything, and advises the country that it's about time we gave that. And of course, availability of vaccine. So far, we have not taken a decision, but we have submitted before. As I mentioned in my presentation, we will engage the team to see whether, under the current circumstances, it is worth taking that step to ensure that some youth between the 0 and 14 are considered. And so that will be the group to provide the advice, and we'll look at that. We talked about the population, less than 40% of the population vaccinated. A significant proportion of the country, the population is also not eligible. 0 to 14, which may come to about 20% to 25% of the population, is not part of the number of people we are targeting to vaccinate. That's why we have dropped it to 22.9% of the million population. That is the population that is eligible for vaccination. And that is the number that we are talking about, 50-something vaccinated. Okay. So, yes. So less than 40, so it's not less than 40%. If you have to calculate based on the number. Obviously, the higher the proportion, the better. But there are many things that we look at. And so if we say, and there was no, I don't remember hearing the president say, don't wear your mask. He said the mask wearing is no more mandatory. I think those of you who see me, I'm always wearing my mask, so I'm not breaking any law. Okay, so he said it is not mandatory, but so we still have he didn't say don't wear, and so there was no advice that don't wear. But currently we are advising that even for those who are not wearing, in indoor spaces, in places where there are large crowd, please wear just to protect yourself and your loved ones. In terms of the booster, it is the policy is that 3 to 6 months after your second dose. And so 3 to 6 months after that, you can always take your, doesn't mean that if it's more than 6 months, you can't take. I would say after 3 months, you can take your booster dose. I think those are the key questions that were asked. Now, me person me use the opportunity. Now, me say Ghana say Ebola biya Emma Ghana. Afi time biya no yare bi ohwa. The Ghana Health Service no disease control for no ye should have say if it be simulation ye should have say Ebola abaha and say cholera abaha ni ahwe say enema ye atoto kwan mu say enya saa ya na betimi aye no ewo ho ana to sin kakra obabi ana ye hwe ne saa na yehu say to sin a ni ahwe ho na aye ho yi se be ya time bia no ya ho bobo ano aye kese enti ni esi otamale no de na tamale region no say ye hwe se in case say yenya Ebola enema ye atoto akwam se be no ewo ho ana ena obi antiase na oka se enya Ebola Ghana enya Ebola bia Ghana ha de bia periodically no ye yesa as a friend simulation to test say che ya homboaboa se be betimi afen doctor asieru bakun de bia na juma o ya na fibia or list of times or be yesa simulation exercise no enti ena obi antiase oka enti mo bia kumanto ni say Ebola bia emba Ghana.
Thank you so much, DG. Ladies and gentlemen, if you have any question, we will give you another opportunity to ask. But if you don't have any question, I will encourage you to follow the Ghana Health Service and Ministry of Health portals, be it their social media handles, their channels for dissemination information, be it newsletters, mass media campaigns, community outreaches, updates by the presidents, and so on. If you hear anything, if there is a speculation, the first thing to do is to go to any of their portals to confirm if indeed they have put out any such information, so that we can curb the misinformation, because sometimes the unnecessary scares and all that does not help at all. So please, I encourage you to look out for some of these platforms, their website, and other channels through which you can access the information from Ghana Health Service and also the Ministry of Health. On that note, I would like to thank you so much for making time for this all-important exercise once again. And as and when it's necessary, I believe Doctor will be gracious enough to come back to update us on our public health outbreaks. Thank you so much for joining us this afternoon. Good afternoon.
Yes.